Welcome to Dementia Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Medicare Options 2026 presented by Mark Gottlieb and sponsored by Prince George's County Government and the Department of Family Services.
So just again, a little more brief introduction. I've been in the healthcare and senior service industries prior to my experience in the insurance business. I'm certified to sell all of the different plans relative to Medicare. So I have a pretty good knowledge of what's going on, what the differences are, what to look for, shall we say, which I'll be sharing with you tonight. I also do a lot of multiple educational presentations around the region and also participate in many senior serving organizations. So that's just a little bit about myself, and we'll jump right into the presentation. We're going to cover all aspects of Medicare tonight, not just an Advantage plan or a prescription drug plan, although we'll certainly be looking at all of those. But I try to give the audience an overview of all of the components of Medicare and how they interrelate. But it's important to understand enrollment. So for those who are prior to 65, you can initially enroll, of course, at age 65. There are other reasons that a person can enroll in Medicare. For instance, for those on Social Security Disability Income, SSDI, you can enroll after 24 months. You can also enroll, as I'll also say on the next page, if you have Lou Gehrig's disease, ALS, or if you have end-stage renal disease, ESRD. Now, I say sign up at age 65 if you so choose. You do not have to sign up when you turn 65. So, for instance, if you're working another year, another 3 years, no matter how long you're working, you have good employer insurance that's well priced, you can certainly choose to keep that insurance. And then eventually, when you either terminate your employment, at this point, where you otherwise known as retirement, you can then sign up. Suggested generally that people sign up for Part A at the age of 65. It's free, but then you can certainly defer on Part B, because for Part B you have to pay premiums. So, those are kind of the ground rules of that. So you go through enrollment. And then every October 15 through December 7, the timing tonight couldn't be better. You're into the annual enrollment period. I'm sure you're all very familiar with that already. We're being bombarded with literature, phone calls, television ads, etc. During that period, you can enroll in or change enrollment in a Medicare Advantage plan or a prescription drug plan. Whatever date you choose to sign up, as long as it's by the 7th, your new plan will take effect January 1. Medicare supplements don't really go by the same schedule. So really the annual enrollment period is really focused on Advantage plans and prescription drug plans. Now I throw into parentheses governmental coverage, because I'll get a lot of people who sit through my presentations. They're not quite sure what they should be doing with Medicare, whether they need to enroll in Medicare, how it relates to all of these ads they're seeing. The answer is, if you have a government plan, and certainly in this area, there are a number of people who have federal plans, state plans, county plans, as well as who may work for some large companies that offer retiree plans of their own. In that case, the open enrollment starts on November 1st. So if you see any announcements about, don't forget, open enrollment starts on the 1st, Of course, those people should have received things in the mail preparing them for that date as well. But it is a different system when you're talking about retiree plans or government plans. So I just point that out. There is actually something called open enrollment period. Like a lot of people juxtapose these two statements. Actually, a lot of people will call this current period we're in the open enrollment period. But technically, we're now in the annual enrollment period. But when you get to January the 1st, you've entered the open enrollment period. That's a time when you can change from one Advantage plan to another, or return to original Medicare and Part D. The issue with returning, though, let's say you've had Advantage for a while and now you decide during the open enrollment period you want to get out, and you go back to original Medicare, known as Parts A and B and a D, but you don't automatically qualify for a Medicare supplement. So if you drop your Advantage plan and you have health conditions which doesn't allow you to be approved for a supplement, then you're going to be lacking that 20% coverage that is not offered through Medicare Part B. Part B pays 80%, and we'll be talking about that very shortly. So these are things to know. And then there's, of course, the special enrollment period. So as I said, let's say you want to keep your coverage, you're still working, now you decide I want to retire on June 30. You can use that to enter into a special enrollment period so that you have private, personal Medicare coverage starting July 1, which will make for a seamless transition. You do not have to wait till the next annual enrollment period. There are other reasons that a special enrollment period is triggered. You might get divorced and you might have been on your spouse's policy. Well, now that triggers an opportunity to use a special enrollment period to enroll yourself. If you change jurisdictions, you need to change, in most cases, you need to change Advantage plans and prescription drug plans. This area, the one exception is the Kaiser plan, which is considered Kaiser Mid-Atlantic. So if you move from one county to the next within this DC metro area, technically you're keeping that same plan. That doesn't trigger a special enrollment period. That sometimes surprises some people. If you move into a nursing home, that triggers special enrollment and you can change your Advantage plan. Or, of course, and this is something very relevant to tonight's discussion in this annual enrollment period, your current Advantage plan is being discontinued. I'm hearing from a lot of people that I never knew, or some people who were my clients who had some different plans and they were notified by mail. Maybe some of you have the same situation, that their plan is no longer going to be offered. So that means you can either enroll in another plan offered by the same insurance company. You can choose to look at other plans, but of course that you can do anyway during the annual enrollment period. Or the big thing is you can actually apply for a Medicare supplement if you would like. We'll be talking about the differences between supplements and Advantage plans a little bit later. But there might be some people who originally wanted to take a, change to a supplement plan. They weren't allowed because of these health conditions. But now, when they get this letter, they can get what's called a guaranteed issue Medicare supplement plan. So keep that in mind. If you got one of those letters, that is an additional option for you. There's, last but not least, a general enrollment period where it's someone who missed the 8-month period to sign up for Part B, which is rare, but occasionally it happens. Then they have to get into a general enrollment period. So that gives you an overview of getting into the program. And now we get into the parts of the program. Again, qualifications for Medicare 65 plus, SSDI, ESOD, ALS. A lot of letters in this field. And speaking of letters, we'll go to Part A of Medicare. So it's zero premium for those or their spouse who have contributed for 40 quarters, otherwise known as 10 years. You've contributed into the Medicare Trust Fund through employment, then you will be qualified to get Part A coverage for zero, which is a tremendous blessing, frankly. There are people who never contributed into the system. They might have moved to this country late in life, didn't work here, coming to live with an adult child, and they need coverage. You can purchase Part A coverage. Full price this year is $2,509 a month. It should go up a little. I'm waiting for the announcement on what that will be. Part A will cover hospital, short-term nursing, post-hospital. Let's say you need to be discharged, but they say you really need a skilled nurse to come to your home and help with, let's say, some of the medications or the infusions you need. Medicare would pay for that short term. Part A also covers the hospice program, which is that offered to people who are terminally ill. Now, although you get all your hospitalization for free and don't even pay a premium, so it's great. There is a hospital deductible at $1,676 this year. It will become $1,716. At least that's what it's projected to be. They haven't put out the final numbers yet, but the projections are usually pretty reliable. So if you only have A and you go into the hospital and you say, well, I'm covered, A covers hospital, and it does cover hospital, but you are responsible for a deductible of this amount. So you have to keep that in mind. Now, if you have a Medicare supplement, which would also include Part B on the next page, or you have an Advantage plan, you wouldn't be responsible for that hospital deductible. But conversely, the copays associated with Advantage plans will pretty much come up to that amount or even a little bit more, because hospital copays are typically meted out for the first 5 to 6 days of hospitalization, but somewhere in the vicinity of $350 to $375 a day. So depending on how many days you may come near the deductible, you may even exceed it a little bit. Now you get discharged after 3 days prior hospital stay. That if you need additional up to 20 days of care in an inpatient rehab or skilled nursing facility. So you had a more significant medical issue, you had a significant accident, you have a stroke. No, you're not ready to go home. You really need to go into a rehab or skilled nursing facility, at least for a few weeks, to continue to get medical care, and they can ramp you up in terms of rehab so you'll be more self-sufficient to be able to conduct your own activities of daily living. So first 20 days free, again, that's great as long as you had 3-day prior hospital. Once you get to days 21 through 100, you're then responsible for paying a copay. It's $209.50 this year. They just announced it's going to $214.50, which is very modest, I must say, projected for 2026. If you have a Medicare supplement, most of them will cover those days 21 through 100. If you have an Advantage plans, you'll pay this, but it will add up towards your copays until you hit an out-of-pocket maximum, at which point everything will be covered. So that's Part A in a nutshell. By the way, if there are any quick questions trying to clarify any of this, feel free. You don't have to necessarily wait till the end of the presentation. So, on to Part B in order to keep this rolling. We probably know Part B covers 80% of outpatient costs. If you get literature about supplement plans, when you see all the advertisements, they're going to tell you, don't forget, Part B only covers 80%. You need to consider buying a supplement which are offered by many different insurance companies to cover the other 20%. Some people may choose not to do it. They may say, well, Part B, 80%, that's great. I'll pay the other 20%. If I have a couple of $100, doctor bill or therapy visit, then, what's that? That means 160, which is 80%, and that would be paid by Part B. All right, I no problem. I'll pay the other $40 for that visit, as long as it's not going to happen, where you have 30 or 50 visits, then that $40 each visit really adds up. And so it is for many other outpatient procedures. So you are taking a chance if you only have A and B, that you can do it as long as you keep in mind you have the responsibility for 20%. And again, if you don't take a supplement but an Advantage plan, those 20% will be in the form of copays until you have an out-of-pocket maximum. So that's pretty much the story. Again, if you have employer coverage, don't sign up for Part B because there are premiums for Part B. Anyone who's on tonight's presentation or already signed up for Medicare will know that. The baseline premium this year was $185 a month. They officially announced that it is going to $206.50. So $21.50 different. We're going to get hit for about $250 more in costs for us paying for Part B. And that's at the baseline. It's based on household. If you have a spouse or legal partner, it's going to be based on the two-person household. So as your incomes go up, the Part B premiums go up. That's a way for the government to try and keep the Part B program going, and fund it. So you just have to keep that in mind. There isn't a table that's called an IRMA table, IRMAA. You build that through Social Security if you have additional premiums based on your income. Okay, so that's something we need to be aware of. There is, as A has a deductible, B has a deductible. $257 this year. That means you have to pay the first $257 before B starts paying that 80%. It's projected to be $288 starting January 2026. Now, for those who are a little bit older and they turn 65 prior to January 1, 2020, and they want a Medicare supplement, they can buy a Plan F, which pays for that deductible. Anyone after January 1, 2020 only can get a Plan G. Coverage is the same, other than a Plan G will not cover that Part B deductible. We'll still have to pay it individually. A couple of other things to think about for Part B, and then we'll be done with A and B and go on to all these other components of Medicare that we have to face during this annual enrollment period. So treatment and observation unit, if you've ever heard the term, you go to the emergency room. It's not just a broken bone or a cut on your finger. It's something neurologic, could be something cardiac, significant type of systemic issues. They do some analysis. They don't feel comfortable discharging you to home, and they suggest at least that you stay a little bit longer in an observation unit so they can further determine what your issues are, or how to treat you, or what kind of medications to send you home with. The costs are going to be going up once you're in an observation unit. ER is expensive enough now with all the different types of testing that they do in a short period of time. But just be aware, observation unit is paid for by Part B, not Part A, even if you're in a hospital and you think, well, Part A covers hospitalization. Yet this isn't considered hospitalization. So that's an issue where, yeah, again, you really want to have some additional coverage. because the cost for staying in an ER and then being there overnight and having them do more testing can be very significant. So that's what I'll say about that. For people who are facing lower incomes, there's the program called the Medicare Savings Program, which will help you with Part B. There's the Extra Help, otherwise known as the Low Income Subsidy Program, that can help people with incomes typically in the range of about 17,000 to 23 or 24,000. You're in that income bracket, and you can usually qualify for some assistance through these programs. So there's a little bit more, if you enroll in the Medicare Savings Program, it'll help you with Part B, you automatically get enrolled in the low income subsidy. But for some reason, it's not automatically the other way around. Okay, so there is information about these programs. You can Google it up. You can email me for information. I'm happy to share what I can. All right, so we're through the governmental programs of Part A and Part B. Now, what else are we going to need? I'm going to start with Part D. I skipped C because C means Medicare Advantage, and I consider that somewhat of a supplemental plan. So I'm going to start with Part D, and then we'll jump into supplement plans and advantage plans. A lot to know about Part D, and my perspective is you should buy a prescription drug plan even if you're not using many drugs or only several inexpensive drugs. The point being, once you get past annual enrollment, you cannot apply for a prescription drug plan until the next annual enrollment period. And then that would go into effect, January 1. So it's a long period. And if something happens within that period where you start using expensive drugs and you haven't signed up for a prescription drug plan, it can cost you. So I basically tell people the lowest cost prescription drug plans, I think this year started at like $4.40. The next one, it was a company, WellCare. Probably some people in the audience have WellCare this year. It had a zero premium. Their premium for 2026, I think, is $5.60. Fairly inexpensive, and if you don't take many drugs and they're the lower tier categories, then you'll probably even get those for zero copay to kind of offset the $4 or $5 you pay for a premium. So I highly recommend it. The other alternative for people who don't buy a prescription drug plan is they use these discount plans. Just about every pharmacy, you walk in, by the counter there, and they're giving out cards for things such as Good RX or Simple Care, and you can get discounts on some drugs. But in terms of anything serious, probably not the way to go. The other thing, just coincidentally, is if you defer buying a prescription drug plan, there's a late enrollment penalty of 1% per month for the number of months you've waited to sign up for a prescription drug plan. If you wait, 3, 4, 5 years, that's a lot of months. And at 1%, it will add up in terms of the extra money you'll have to be paying for a prescription drug plan, and that will not be taken away. It's not a penalty for a year or two, it's with you for the rest of your life. So it may not be a lot of money, but if you look at it in terms of the consolidated amount, that's of significance as well. So Part D plans provided by private insurance companies for the most part, or of course, if you get an MAPD, Medicare Advantage prescription drug plan, such as offered by Kaiser. There are other companies, of course, that offer MAPDs, and I will show you those, but all of those are insurance companies, not managed care organizations. But in any case, you sign up, they're probably about 10 companies that offer prescription drug plans, and each of them typically offer at least 2 choices. So there's 2 phases in the drug plan program. There used to be 4. Luckily, the donut hole, which so many of us know who were in Medicare, at least a few years, that's been eliminated. Even of greater significance, the catastrophic expense requirement was eliminated. That was for people who had really, really high drug costs for serious medical issues, and they had to pay yet additional sums of money to get the drugs they require. That has now been eliminated. So at least for this year and for this time, we're very happy about that. There's 2 phases. There's the deductible phase. It was $590 this year, going to $615 next year. So if you take some low expense drugs, they're kind of based on a retail model. If you take some low expense drugs, you may not even hit that deductible level. Doesn't mean you don't get any drug coverage until you spend $590, and you're getting the drug coverage, and the retail prices with a drug plan is still better than they would be if you didn't have a drug plan. That I can tell you. So you're getting hit with the deductibles up front. You're paying the copays. Again, if you have low expense drugs, you may never reach your deductible, which is not a problem. That's a good thing. For those who are taking more serious and expensive drugs, you may hit that very quickly. May even hit it in the first month, or at most the first 2 months. So I dropped down here to newly activated Medicare prescription payment plan. If you have one of those high price drugs and you say, I don't really have $590 to put out to get this drug in January, you can sign up for the prescription payment plan, and it will average out the cost of your drugs for the year. So let's just round $590 to $600. That's the only drug you take. It'll average it out for the year, would come to $50 a month. So in January, you don't have to come up with $600. All you need to do is come up with the $50. Just an example of how that program works, but it's certainly very helpful to a lot of people. Once you hit that first deductible limit, you then go into a tier-based system of copays. Many of you, I would think, are already familiar with the tiers. There are 6 tiers. The 6th one is for insulin at $35 a month. The first 5 or cover everything else. The most expensive ones, as you go up, they're more expensive. You're paying higher amounts. So that's just the fact of life. But again, the good news is last year they instituted a $2,000 out-of-pocket max. It's only going to $2,100. I think pretty reasonable. So once your drugs, these in the deductible plus whatever else you're paying in the tiers, once your out-of-pocket payments for all of these drugs reach this amount, you're then 100% covered. Also, a great feature, I believe. So we're lucky about that. Now, a couple of other very important things to note. Your plan selection should be based on the total cost of premium plus your cost of the copays. So don't go buying a plan because the premium is $5, no matter what drugs you're taking. You need to look at that $5 a month plus the cost of the copays. Those 2 factors together are going to add up to the total expected out-of-pocket costs for you. Okay, so that's very important. There may be a plan that's $50 a month premium. Well, that's sure a lot more than $5, but they're charging less in the copays. So if you add everything up, I'd rather pay the $50 in premium, but if I take everything into account, I'm going to pay less over the course of the year than automatically picking the least cost plan. Now, in some cases, of course, the least cost plan may also end up being least cost when you factor in the cost of the copays, but you must take those two factors into consideration. There's a plan finder, the Medicare plan finder on medicare.gov, and you go through a series of prompts, and it takes you to charts where you fill in each of the drugs you're taking and the dosages and the frequency of use. Okay, so I put in amlodipine, click the button next to it. It says 10 milligrams, 20 milligrams, 50 milligrams, tablet, capsule, whatever the case may be. You click the right amounts. When you're done adding drugs, click done adding drugs. There's one other prompt, and then all of the plans will come up right before your very eyes. For each plan you want to look at, you can hit a box that says plan details. And I point that out because you want to make sure your drugs are covered by the company's formulary. Each of the drug companies may have different formularies. So at the top of the list, which is the least total cost, I say, well, that's probably the plan for me. I like it, but let me look at the plan details, and you click plan details, and then it will show you this is how many of your drugs are in the formulary. And this is important stuff, at least from my perspective. So, okay, Mr. Gottlieb, 4 out of your 5 drugs are in the formulary. Uh-oh, which one is not in the formulary? And I scope down and I find out probably the most expensive drug is not in the formulary. That's a problem. Now I'm going to want to go down to the next least expensive. And I'm going to hit plan details, and I'm hoping in that plan it will show 5 out of 5 drugs in the formulary, meaning I'll be covered for that drug. I'll be able to get it, and pay a copay. If none of them have your drugs in the formulary, that's definitely a problem. You either need to speak to a physician and say, what can I do to substitute this drug? Worst case, you can't do anything. They absolutely insist this is a drug you must have. The prescription drug companies are not covering it. Then you've got to go to something like a Good RX and see what kind of discounts there are on that drug. So that's pretty much the sum up about Part D prescription drug plans. And, I encourage people to evaluate your coverage on an annual basis because things are changing. I'm in the Medicare program. I've changed my coverage after doing my own Medicare plan, analysis, the Medicare plan finder analysis. So heed that suggestion. Little bit more, again, Medicare Savings Program and low-income subsidies. If anyone needs more specific information, contact me. Again, I'll have my email and phone number at the end of this presentation. There's certainly some literature explaining these programs. There's also something in the state that a lot of people are not familiar with called the Maryland State Pharmaceutical Assistance Program. So you may have greater income than what it takes to qualify for these lower income plans. You could have up to about $45,000 in income, sign up for the State Pharmaceutical Assistance Program, and they'll pay Part D premiums up to $60 a month. May even be adjusted upward a little. I haven't checked in a little bit, but hey, $60 a month times 12, that's $720 that I just found by putting in my application for the Pharmacy Assistance Program if I qualify. That's not a bad deal, frankly. It's great. I mentioned retiree plans at the beginning. So if you're in a federal plan, a state plan, a large company plan, most of the time you're going to be doing better than if you're in the independent market as an individual. But what you need to do is at least be aware of what you have, what the premiums are, what your options are, because you don't want to just have a, hey, do you need help with Medicare? Do you have coverage? No, I'm good. I have this retiree benefits FEP card. I'm all set. Well, don't be so quick to say you're all set. You need to know which FEP plan you have. There's multiple plans. Just the Federal Employee Health Benefit Program to start. There's a low option, a standard option, a high option. Each of them give certain different amounts of benefits. They have certain amount of copay requirements, etc. So I just, let people know. I think that it is important for you to take the time to check however you can, whether it's by Googling up information, calling a customer service rep at OPM, Office of Personnel Management, your company's, HR department, whatever, and know what you have. And, maybe compare premiums. Maybe there are some plans you're in that aren't as good as others, and the premiums are higher than they would be if you did sign up for Medicare. So, buyer beware is my perspective on that. Okay, so now we looked at ABD. So what's left to talk about? What are the gaps in coverage? A and B deductibles, the 20% copay for Part B. Copays days 21 through 100, all things we've discussed. Something called excess charges. There are certain physicians and other providers who may participate in the Medicare program, but not fully. There's actually two levels of participating providers. Fully participating, they will accept whatever plan you have as payment in full. And non-fully participating, but if you call the person at the front desk and say, I want to make an appointment to get treatment or care at this place, I want to make sure you accept Medicare. Yes. Well, you better get a little bit more specific about, do they accept Medicare? Just like, do they accept Medicare Advantage? Well, they may accept one Advantage plan, not another. You want to know which those are. You're going to want to know, and I'll talk about this, in a little bit further down the road, about just whether they take in-network plans or out-of-network plans. So there's a lot to be aware of to protect ourselves, because that extra 15% can hurt if we're not covered for it. I will tell you, some of the Medicare supplement plans, depending on the ladder, do cover the excess charges as well. So ideally, you would like to have that coverage as part of your Medicare supplement if you are going the supplement route. Now, with the next number of features we generally associate with Advantage plans, and you're seeing the advertisements right now: dental and dentures, vision and hearing. Some have acupuncture, some have podiatry. Most will give you at least something at this point for what we call over-the-counter OTC medications and supplies, not the prescription drugs that you get through the Part D program, but just generally things, shall we say, off the shelf. So how do we protect ourselves from these gaps? We're either going to go with a supplement plan or an Advantage plan. So now into the supplement world here, there's several important things that we should be aware of. They are sold by private insurance companies. They offer total freedom of choice to use any Medicare provider in the United States. And so any provider that accepts Medicare, there are a small number of providers who may not accept Medicare. They just added a system. Classic example is, I'd say, there are a number of psychiatrists whose fees are very high, and they think the Medicare fee schedule is ridiculous, and they're just not going to participate. It's not worth their time, and they're a fee-for-service operation. So those don't count, because the supplements only count if the provider accepts Medicare, because the supplement's going to supplement what Part B is paying the provider. The most popular plans are F, G, and N. I mentioned that F you can get if you were on Medicare prior to January 1, 2020. Otherwise, we've shifted to G, which is Everything's the same except with a G, you will have to pay the deductible. We talked about that Part B deductible of $257 going to $288. Plan N, a little bit better pricing, but we need to be aware that there are 20 copays per $20 copay per doctor visit. If you don't have a lot of doctor visits, then probably well worth it to save some money on the premium. The only catch there is that, let's say you start having medical problems, you're going for a lot of outpatient visits. There are things other than doctor visits. There's some outpatient procedures and services which also trigger a $20 copay. And now you say, well, now I'm really going a lot. I better switch up and buy a G. The answer is no, you can't do it, because the insurance company knows now that they're going to be paying out that much more in the supplemental payments. So they are doing what's called underwriting you. They're medically considering whether or not, they want to offer you a Medicare supplement plan. So it's a dilemma, because, we'd like to save some money and we don't know how long. Maybe we're going to be pretty healthy, for the next 10 or 15 years, but we don't know. But if medical problems start besieging us, we can't just automatically shift, to an F or a G, depending on your age there. There are a number of plans in addition to F, G, and N. This is out of order, but there are also plans called high deductible plans. The premiums are much less, but the first $2,900 of deductible. The good thing about having one of these plans is, again, you have the freedom of choice, and you can go to any Medicare provider. You don't have any restrictions of networks. And if you think you're pretty healthy, the premium is much lower than the typical premium for an F, G, or N. So you pay a low premium. Maybe you just don't have that many medical expenses, so you'll never reach that $2,900. So you did pretty well from that perspective. The other side of the coin is if you expect to have a lot of expenses and you're in a Medicare Advantage plan, and you could switch out to a high deductible plan, might be because of a guarantee issue situation. And you have the low premiums, and even if you hit the $2,900, you're then 100% covered. You're going to hit the $2,900 and more if you're in an Advantage plan. You might have copays with an out-of-pocket maximum of $7,000 to $8,000. So that's the risk of Advantage plans. So, and that's the good feature of supplements. So two other things. When you first sign up for B, there's no medical underwriting for the first 6 months. So it doesn't matter, you have a heart condition, you're being treated for cancer, on and on and on. You just signed up for B, you have 6 months. They will automatically provide you with a Medicare supplement plan if you apply for it. No medical underwriting. There's also guaranteed issue coverage under 2 conditions. I know this is a lot of information, but that's why I try to do these presentations, so bear with me. Guaranteed issue coverage if relocating with an Advantage plan from another geographic area. Okay, I get this a lot more often. It has to do with, let's say, an adult child who's having one of their parents move closer to them, so they're bringing them here from Pittsburgh or from Florida or from Kansas City or wherever they are, and the parent has a Medicare Advantage plan. At the very least, they're going to have to replace that Advantage plan with another Advantage plan, because Advantage plans are local, okay, and they're jurisdictional. With a supplement, they're not jurisdictional. You can take them portably all over the country. But the point is, if that parent is enrolled in an Advantage plan wherever they are living and they're moving to Maryland, there's also some other states that have this feature, then they can qualify for a guaranteed issue Medicare supplement, which could be, very good. Okay, if you're losing an Advantage plan, again, where a lot of us are facing that, we're getting notices from our Advantage plan saying this specific plan will no longer be offered. You need to find a new plan. I know I'm in the supplement section talking about Advantage plans, but if that's your situation, you can get a Medicare supplement guaranteed issue. So I wanted to make that point. The other thing is there's now a birthday rule in several other states. It's in Maryland, which I'm talking about right here, allows a person with health conditions to shop around and get a different Medicare supplement plan. So typically you can buy a Medicare supplement any time of the year if your health is good enough to do so. But if it's not good enough to do so, so let's say your supplement plan costs have gone up, because supplement plan costs go up every year. So over the years, your supplement may become that much more in premiums. Now you'd like to see if there's another plan from another insurance company offering a better deal. You don't have a big health problem, you could do it any time of the year. You have a big health problem because of the birthday rule, the month of your birthday, you can now shop around and possibly get a better deal on your supplement without worrying about medical underwriting. So these are several very important facts, I think, that I like to share. All right, so that's supplements. Again, I'm happy to take any quick questions if there are any. If not, I'll charge on to the last segment, and that will be Medicare Advantage. Of course, we're being bombarded with information about Advantage plans. Some of us may have them, so we kind of understand how they work. Provided by insurance companies, or again, in the case of a Kaiser, local healthcare delivery system, as opposed to just being a straight insurance company. So Kaiser gets an insurance license to be able to offer Medicare Advantage plans. Johns Hopkins, another area, healthcare delivery system licensed to offer Advantage plans. Unfortunately, they don't offer that product in Prince George's County. But other than that, they're all insurance companies who now have Advantage plans. You must have parts A and B, so you can't avoid the premiums you pay for Part B by signing up for an Advantage plan. Multiple types of Advantage plans, regular Advantage plans for most of us, dual eligible, meaning you have both Medicare and Medicaid. For Medicaid, if you are either on full dual benefit or qualified Medicare beneficiary, QMB, you actually would then qualify for a dual eligible Advantage plan, which gives you a lot of extra benefits. Last but not least, and again, not that well known, veterans can choose to enroll in a Medicare Advantage plan. They can do so. That's just a Medicare Advantage plan without the prescription drug if they're getting prescription drugs through the VA. But signing up for these plans allows them to dramatically expand the provider base that they live in Greenbelt, they can join a veteran plan. There's going to be a network of providers in the Greenbelt area that will provide services to them for some copays, but it will keep them from traveling into the VA Medical Center on Irving Street in DC or shooting out to Baltimore. So it's a much more convenient-based way of getting service. So why do we enroll in Advantage plans? The low premiums are very attractive, and they also provide some value-added services such as basic dental, vision, and fitness memberships. But remember, the downside, to some extent, there's several. One of them is the networks, which I'm going to talk about on the next page. The other downside is you do have a series of copays. So if you have a, significantly medically challenged year where you're getting a lot of services which all require copays, it can add up, to a significant amount until you hit an out of pocket maximum. So copays for service, including the first 5 or 6 days of hospitalization, et cetera, et cetera. Two good features of Advantage plans, two great features, consistent pricing regardless of age. So I'm buying whichever of the plans, and I'll show you the list of them I want. What's the cost? Doesn't matter whether I'm inquiring and I'm 65 years of age or 95 years of age. It's still the same community-based price, which is very good and certainly much different than Medicare supplement plans. Again, no medical underwriting. Anyone is accepted. So you apply for a supplement, you've got health problems, they say no thanks. You automatically can just go and apply for an Advantage plan. They don't even ask you any health questions. So that's a beautiful thing. There are two types of plans. You'll always see these acronyms, if you will. They're HMO plans and PPO plans. HMOs will only cover in-network providers. Make sure you know who you might want to be using. You certainly want to inquire with your primary care physician, and if you use a particular specialist that you'd like to continue to go and see, you want to make sure, especially if you're buying an HMO plan, that these people are in network, because you cannot go out of network. You go anywhere else. I've had people who didn't totally understand this, and they say, well, I have this orthopedist and she is not in the network, but I called her and she said, well, I'll take, the 80% from Part B, and, I won't ask you for any copay. The answer is Medicare will not pay the 80% of Part B. The Advantage plan now owns your Parts A and B. So if you're in the HMO, you're in the network. If you go out of network, you're paying 100% on your own. The beauty of the PPO movement is that they will allow a person to go out of network to certain providers, assuming they will accept the out-of-network fee from that particular insurer. It will lead to greater out-of-pocket costs, which I know most of us are not really looking for, but occasionally, if you need to go out of network because there's a particular provider that, it's highly recommended or highly specialized, they're only taking out of network fees, you're going to go there. Now, prescription drugs are included, but at no additional premium. That's a good thing. So when you see all the ads, they're going to say, yeah, and if you join this plan, you're getting all your prescription drugs. Well, don't be fooled, because they won't charge you a separate premium that's folded into the overall premium for the plan, but that's still operating on a copay and tier basis until that out-of-pocket maximum, just as if you had a freestanding prescription drug plan. So, I think they're kind of misleading, but again, when you have a 1-minute advertisement, you're not going to go into the details, especially any of them which may cause people not to call you to join your plan. So major issues, be aware of the networks. That includes hospitals. These are all based on contracts. If you want to, go to a particular hospital, if you're going to need hospitalization, you want to know, if I need care, I want to go to a particular hospital, or I want to know my, orthopod, if he or she is going to do orthopedic surgery, which hospitals do they practice at? You want to make sure those hospitals are in that network. Secondly, and what's become kind of controversial, is the Advantage plans are getting more and more highly oriented to doing what they call asking for prior authorizations and even submitting denials for continued service. Now, this usually relates to the more expensive, stays, the more expensive procedures, extended rehab stays. We're hoping we're not going to be one of those people that falls into that category. But if you do, that's a risk of an Advantage plan. I read the literature, and they say probably 5% of cases can fall into that. If you're doing anything, less severe, you're okay. But when you're getting into more extensive treatment or special procedures, you do have to face that situation. So I'm coming up on 8, and I'm about 5 minutes from the end. So we're doing good here. Few additional features we need to think about. So they usually also say, and we offer you dental. So it's a little like my comment on prescription drugs. The way you look at those advertisements, it makes you think, oh, my problems are over. I've been meaning to have this root canal done or this implant. And now if I join this plan, they're giving me dental coverage. Well, the realistic situation is most of them, I say many at least, offer only preventative features of dental, fluoride treatment, exam, x-rays, things of that sort. Now, what happens now if the exams and the x-rays figure that now I do need that implant, or any of a number of other procedures? Well, it's not going to cover that, but you can. Well, there are a few plans now. Let me take it back. Usually the ones that have a little bit more premiums may have a little, treatment dental built in. But typically they're based on preventive. So if you want some money to help you pay for treatment for the procedures that they find you need, you will ask for a buy-up. So they'll offer you a plan which says, okay, your premium for the plan is $42. Some are even $0, but whatever the premium is. But if you want dental procedure dollars, so to speak, you need to pay up. Could be $25 to $35 a month in order to buy a certain amount of treatment, dental. And of course, you could also purchase a standalone dental plan. So you join an Advantage plan, you'll be happy to take them up on these nice, valuable preventative services. You might also pay a little bit more money by what I call a standalone dental plan. There are many, Care First in this area has a very good standalone dental plan, several of them. A lot of the big companies, Mutual of Omaha, Humana, Aetna, etc., all have dental plans. So you don't have to be in an Advantage plan. In fact, a lot of the people who join a Medicare supplement plan, because supplement does not offer dental, will then go ahead and buy a standalone dental. But just be aware of what you're getting. Here they'll give you a hearing exam. They'll offer hearing aids and dentures at discounts. You won't get them for free by any means. Some of the dual eligible plans will offer them, remarkably enough, paid for pretty much by the Medicaid program. I suspect that by next year at this time, unfortunately, given what is going on in Congress, I suspect the Medicaid programs are going to be taking a big hit, and some of the extra features that are offered through the Advantage program, dual eligible programs, will no longer be in place. But we can, perhaps I'm wrong, and perhaps the program will be saved. But in any case, if you're not in the dual eligible plan, you could still get some plans with hearing aids and dentures. You want to shop around from plan to plan and see what kind of add-on pricing is associated with getting these products. Vision, they'll typically give you 200 toward glasses or lenses. Fitness facility discounts. Most have relationships with this organization called Silver Sneakers, national contracted organization to offer discounts at fitness facilities. And then some plans will offer chiropractic and acupuncture, some won't. So if that's of particular, interest to you and helpful to your life, then of course, when you're shopping around for plans, you're going to see which ones offer those services. So now I shall go to Prince George's County. So now, interestingly enough, AARP United Healthcare has all but left Maryland, frankly, except for veterans plans and dual eligibles, but they're not offering a regular Medicare Advantage plan this year. So from my research, we're down to 4 companies offering Advantage plans. Each of them will offer several options, and the options will be, their deductibles, are the copays different from one plan to the other? What are some features associated? I use the example of the acupuncture and chiropractic. You take the $0 premium plan, it may not be included. You take the $40 or $50 plan, it may be included. Again, based on